Hey, Jimothy. Yeah, boss, what's up? Why are we spending so much money on cataract surgery? It's a really common surgery. Well, can we not do that? Can we not cover cataract surgery? Yeah. No. People need to be able to see. Well, can we do that thing where we get to practice medicine without a medical license? Prior authorizations? Yeah. What if we require prior authorizations for every cataract surgery?
If you think what he's describing in that video is a bad idea, you're right, it is. What he's describing is prior authorizations, and that's when health insurance companies require you, the patient, to seek their approval before receiving medical care that you need. Then, the health insurance, not your doctor, will decide whether or not you can get that treatment and if they'll cover it. This is a really bad idea, and it's another example of why our healthcare system in this country is so broken.
Do you have any idea how many cataract surgeries there are every year? I don't know, like 100? 4 million. This would be a huge burden on patients and doctors. Oh, come on, doctors won't care. You're forcing eye doctors to ask a room full of business majors for permission to do eye surgery. I think they'll care.
When you inject capitalist interests into the medical industry, you're going to get outcomes like this, because then they have a financial incentive to reject your claim. The less money they spend covering treatment for you, the more money they can make. So it seems like a really bad idea. And that's why the United States is the only developed country in the world without a universal healthcare system. But let's talk about prior authorizations a bit more. To make things even more complicated, there isn't a uniform standard across health insurance companies or plans for what procedures or treatments or medicines require prior authorization. So that leaves some people in the dark or flying blind when making difficult medical decisions. Sometimes the doctors themselves, the ones that take these insurance plans, don't even know what is and is not required to have prior authorization. And that's led to people getting care and then later getting hit with a giant bill from their health insurance company, which decided to reject the authorization. And there's a wide range of treatments and medicines that fall under this domain. It could range from surgeries, like this video talks about, to x-rays, to medicines, to cancer treatment.
We have to do this. Why? Look, I don't want to alarm you, but I went through our finances. We only made $8 billion in profit last year. Okay.
For instance, take the case of Gilbert Aguirre. He's a firefighter in Arizona who was diagnosed with chronic myeloid leukemia 7 years ago. His doctor said he got it on the job as a firefighter. And the entire time he's been dealing with leukemia, his insurance company, CopperPoint, which he gets through the city of Goodyear, Arizona, has been denying his claims. They've been denying him treatment for his leukemia. He's tried to appeal, he's tried to fight back, he's tried to explain, and every single time they keep rejecting his claim. His most recent denial was a couple weeks ago. And he's at the point now where he could retire, but he can't, because he needs to keep working so he can pay for the medicine that prevents the leukemia from coming back. And that medicine is $15,000 a month. So, in his words, he has to keep working until his body gives out.
So I was thinking, if we can just delay all the cataract surgeries for a few months, we can hold on to all the patient premiums and make more money.
And he's far from a unique circumstance. In early 2020, a Michigan cancer patient, Forrest Van Patten, was told by his doctors to get cell T treatment. And Gilbert's case is hardly unique. In early 2020, a Michigan cancer patient, Forrest Van Patten, was told by his doctors that he needed CAR T treatment to deal with his cancer. They said this would kill the cancerous cells in his bloodstream and save his life. But when Van Patten sought authorization from his health insurance company, Priority Health, they rejected the claim. They said it wasn't a covered benefit. So his family did what hundreds of thousands of Americans do every single year, and they started a GoFundMe to try to pay for his medical care. They reached out to their local news. They wanted to get attention on the story, and they hoped this would help bring about change. A story ran on February 13th, 2020, talking about his fight against his insurance company. Forrest Van Patten died 4 days later. And what makes this even more enraging is other health insurance companies in Michigan cover that treatment. And because health insurance companies can pick and choose what they want to cover and what they don't, That leaves people like him in this situation. Often, people have to try to fundraise on the internet to cover their medical expenses, or they die.
Wondering what it's like to live in America? I had a 10-minute video call with my neurologist, and it cost me this much money.
Now, I have a joke that I do. I say, if anything happens to me, I got to get in the car. You know why? Because my car insurance is so much better than my health insurance, it might be the only way I can go. Now, I do that as a joke, but our health insurance system is a joke, and it's a joke that's not funny. This young lady in the video is looking at paying $400 for a 10-minute virtual visit to a neurologist that she has to make.
My insurance covered $142 of the $434 bill. The call was 10 minutes and it went like this. Julia, are you still getting migraines? I said, yes, doctor, I am. He said, okay, Julia, we're going to up your prescription and you're going to take 3 pills a day. I said, okay, thank you, doctor. That was it. And I have to pay $291 for that?
She has debilitating migraines. She can't work when she has them. She can't drive when she has them. So she obviously needs to be treated and get her medication, and it costs that much. And that money isn't all going to the doctor. That money's going to the bureaucracy, layers and layers of bureaucrats. That money's going to pay some healthcare CEO millions of dollars. The medical billing system is so complicated, you have to go to a school just to learn it. You've seen it. You've seen those daytime commercials. Learn medical billing in 6 weeks and you can get a good job. It might be a good job, but why does it take so long to learn just the system? This is why when you go to a doctor, the first question that they ask in the office isn't how you're doing. The question they ask is, what insurance do you have? The medical care system we have is broken. It is a patient that needs emergency care. So the first problem, as I see it, is Congress. Congress, senators, legislators, any representatives, you know what the problem is? They have gold-plated medical insurance. They can't imagine what this woman is dealing with, paying so much money to go to a virtual doctor. Some of them probably have doctors come to them. They certainly aren't going to virtual doctors. They're not hanging out in emergency rooms for hours and hours to get basic treatment like so many Americans are, okay? They're not paying big parts of their salary for crappy insurance. Again, like so many Americans are. These Congress people, these representatives are well paid, and they're well paid by lobbyists. Lobbyists in the healthcare industry who see no reason to change because they're all getting rich. This has to change. We have to break this cycle, okay? It's untenable. It cannot keep going. Listen, I have another joke that I do about anything happens to me, I ain't going to the doctor, I'm going to the vet. Well, I have a friend who's a doctor, and he told me he'd rather be a vet. You know why? Because the vet gets paid when your animal goes to the veterinarian, which means this system isn't favored by doctors either. Nobody's happy. The doctors aren't happy. The patients aren't happy. Who's happy? The bureaucracy's happy. Who's happy? The legislators getting paid by the lobbyists. This system is broken.
I cannot afford that. And it's like, they're debilitating migraines. They're visual. I can't drive if I get them. I can't work if I get them. So I have to see a neurologist for this.
Oh, and the young lady in the video, she is an average American, okay? She is an average American looking for healthcare. She's not old. She's not unusually sick. She's not a black or brown person looking for entitlements, okay? She's not an illegal alien that snuck across the border to get a free heart transplant or any other crap that they try to scare you with. No, she is an average American. And if she's between the ages of 25 and 34, which is what it looks like to me, the average American makes $776 a week in that age group, okay? And that's before taxes. So imagine one doctor visit that she has to do is going to cost her 1/2 of a week's salary. If she's average, okay? That's just going by the middle. This is broken. This you got to be kidding. 1/2 a week's pay to visit a doctor once for a condition you must have. And she's lucky. Let me tell you something. She's lucky that evil Obamacare exists. Otherwise, they might write off her migraines as a previous condition, okay, that they're not going to cover because you already had it. Yeah, it's broken. The system is broken, and this is average Americans. This is not any special circumstance that is looking for an entitlement. She's mad at America. She should be mad at America, because if healthcare is an entitlement, we've got a serious problem.
$300 to get the help that I need? This country is a joke. It is a joke. I hate it. I hate it.
So, what do? What's the solution? Well, listen, if I had a simple solution to America's healthcare problem, America's healthcare crisis, I would be paid off, or maybe bumped off, by the healthcare industry. Yeah, I said it. Go into the room to the doctor with a hangnail, and we had to put him down. He knew too much. Listen, I joke, but again, this is not a joke. The system is broken. And I think the first thing we need to do is realize we are all in the same boat, and the boat is sinking. That's right. It doesn't matter who you are. So everyone needs to get on this. Young people, vote. Don't give up. Don't give up. I know how frustrating it must be if you're in your 20s or your 30s and you're looking forward at this system. You got to vote. You got to do it.